Trinidad and Tobago's COVID-19 vaccination rollout will resume on Friday. Speaking at the Ministry of Health's virtual media conference today, Wednesday, Minister Terence Singh said the country received China's donation of 100,000 Sinopharm vaccines just after midnight. Those eligible are encouraged to make their appointments from today using the designated call-in numbers or WhatsApp numbers for the various regional health authorities. With the addition of the Sinopharm vaccine to TNT, Minister Singh used the advice given to the U.S. population by their health experts.
Vaccine is available to you, take it. The best vaccine for you is the WHO vaccine that is available to you at this point in time. We are only bringing in WHO vaccine, so you have that stamp of approval, that stamp of confidence. Whichever vaccine is available for you at that time is the best vaccine for you.
The minister said with the Sinopharm vaccine, an individual can be fully vaccinated in under a month, whereas with AstraZeneca, there's a 2 to 3 month window to get fully vaccinated. Those being vaccinated in this phase are people over age 60, those under 60 with NCDs and obesity, and healthcare workers. Minister Singh said all vaccinations will be done strictly by appointment, as no walk-ins will be accepted.
AstraZeneca vaccines will come in a vial of 10 doses. So once you open one, at the end of the day, if there's nobody else, then you could accommodate walk-ins, which used to happen. However, the Sinopharm vaccines are packaged differently, in that they are packaged in a vial of 2 or 3, I believe. 2 or 3 doses. So there's no more flexibility at the end of the day to vaccinate walk-ins.
The expiry date of the Sinopharm vaccines is April 2023. With 80 million doses of COVID-19 vaccines pledged to countries across the globe, the United States has considered itself the largest donor of the vaccines in the world. This according to the coordinator for the global COVID response and health security at the U.S. Department of State, Gail Smith. Earlier this week, U.S. President Joe Biden vowed to send 20 million doses of U.S.-approved vaccines, in addition to the 60 million doses of the AstraZeneca vaccines already pledged to foreign countries within 6 weeks. While Ms. Smith could not confirm the number of vaccines that will be distributed to member states within CARICOM, she said the U.S. will be considering ways to boost supply.
We are looking at all regions, given the constraints in vaccine supply literally everywhere. And we have not made final decisions, but I can tell you that we are looking closely at every region and that we are well aware of, and I've had the honor of meeting with several representatives of CARICOM about this, as well as Latin American countries, of the acute needs, in fact, on or near our borders.
In terms of the time frame, she said other factors such as additional supplies need to be considered, adding that the U.S. is consulting with the COVAX facility.
The time period that was referenced has to do with the need to actually have those vaccines in hand, figure out the distribution, but also because on the AstraZeneca 60 million doses, we need FDA clearance before those move in order to ensure that they are fully safe.
Ms. Smith said the U.S. government will continue to invest in manufacturing sites around the world to increase supply of vaccines over the short and medium terms.